A silent invader unveiling West Nile virus. West Nile virus, often shortened to WNV, is a serious concern for the well-being of animals worldwide. This virus, first discovered in Uganda in 1937, has spread far beyond its origins. It now impacts animals across the globe, making it a truly global threat. While it can infect humans, our focus here is on how WNV affects animals. WNV is a silent invader, often causing no noticeable signs in those it infects. However, don't let this fool you. This virus can be a wolf in sheep's clothing. In some animals, WNV can lead to severe illness and even death. Understanding WNV is the first step in protecting animals from its impact. This virus primarily targets birds, but it also poses a risk to mammals like horses and even our beloved pets. The good news is that WNV doesn't spread directly between animals. Transmission relies on a tiny but mighty carrier, the mosquito. By understanding how WNV spreads and the threat it poses, we can take steps to shield animals from this silent but potentially deadly virus. Mosquitoes on the move: the spread of West Nile virus. Mosquitoes, specifically Culex species, spread WNV. They pick up the virus from infected birds and transmit it to other animals. The virus enters the mosquito system and reaches the salivary glands. When the mosquito bites another animal, it spreads the virus. This cycle continues, spreading WNV across wide areas. Transmission risk is highest during warmer months. Standing water exacerbates the spread. Understanding mosquito roles helps in prevention and control. Targeting mosquitoes and protecting animals can disrupt the virus's life cycle. Inside the infection: how West Nile virus affects animals. Once a mosquito carrying WNV bites an animal, the virus enters the bloodstream and begins to replicate. In many cases, the animal's immune system may successfully fight off the virus, preventing any noticeable illness. However, for some animals, the virus can lead to a range of health complications. In these cases, the virus often targets the nervous system, leading to inflammation of the brain and spinal cord. This inflammation, known as encephalitis or meningitis, can disrupt the normal functioning of the nervous system and cause a range of neurological symptoms. The severity of the disease can vary depending on several factors, including the animal's species, age, overall health, and the amount of virus they were exposed to. Some animals may experience mild flu-like symptoms, while others may develop severe neurological complications that can be life-threatening. It's important to remember that while most animals infected with WNV recover fully, the virus can have lasting impacts on the nervous system in some cases. Early detection and supportive care are crucial for improving outcomes and minimizing the long-term effects of this potentially debilitating disease. Section 4. Recognizing the threat. Symptoms of West Nile virus in animals. West Nile virus often flies under the radar, causing no symptoms in many animals. However, when symptoms do appear, they often signal that the virus has infiltrated the nervous system, leading to potentially serious complications. In horses, West Nile virus often manifests as a loss of coordination, making it difficult for them to walk properly. They might stumble, drag their feet, or appear weak in their hind legs. Other signs include fever, loss of appetite, depression, muscle twitching, and in severe cases, paralysis. Dogs and cats are less commonly affected but can still show symptoms like fever, lethargy, loss of appetite, vomiting, diarrhea, and seizures. Birds, particularly crows and jays, are highly susceptible to West Nile virus and often die from the infection. If you observe any of these symptoms in your animal companions, it's crucial to contact your veterinarian immediately. Early detection and supportive care can significantly improve the chances of a full recovery and minimize the risk of long-term complications. Section 5. Combating the virus: diagnosis, treatment, and prevention of West Nile virus. Diagnosing West Nile virus requires a veterinarian's expertise. They'll consider symptoms, medical history, and mosquito exposure. Blood tests detect antibodies confirming the diagnosis. There's no specific cure for West Nile virus. Treatment focuses on supportive care to alleviate symptoms. Prevention is key in the battle against West Nile virus. Minimize mosquito breeding grounds around your property. Use insect repellents designed for animals. Vaccination is crucial, especially for horses. Keep horses up to date on vaccinations to reduce risk. Proactive steps in vaccinations safeguard animal health.